Defibrillator. We'll say something about defibrillator, how it functions, and what are the situations we use the defibrillation. So what are the preparation we have to do for the patient. So the objectives are define defibrillation and describe the need and history of defibrillation, describe the principle and mechanism of defibrillation, and types and classes of defibrillator, describe the automated external defibrillator, that is shortly we call this AED, and identify the precautions and risk of troubleshooting of defibrillator. So this is the model of defibrillator. You can see the paddles, we will keep it side, and the ECG readings. So we can keep the ECG strip and we can take the readings, and all the modes are available in the defibrillator, and we have to charge the defibrillator. So coming to the introduction, defibrillator is a process. So it's an electronic device. It sends an electric shock to the heart to stop an extremely rapid irregular heartbeat. So example, the patients develop any dysarrhythmia, so we will be applying the shock to the patient's heart in order to regulate the heartbeat and normal heart rhythm. And it mainly treats the life-threatening cardiac dysarrhythmias, ventricular fibrillation, and pulseless ventricular tachycardia. A need for a defibrillator. So ventricular fibrillation is a serious cardiac emergency resulting from asynchronous contraction of the heart muscles. So mainly it helps to treat the irregular rhythm and in case of asynchronous cardiac contraction. So you can see the ventriculation, fibrillation. So the leads you can see, and the normal heartbeat. So the normal rhythm we call the sinus rhythm. And ventricular fibrillation will be converted more efficient rhythm by giving high energy shock. So high energy shock usually we will give above 200 joules. So it's a sudden urge across the heart, causes all muscles. So whenever we are giving a shock, the cardiac muscle will be contracted simultaneously, and there will be a response in the fibers, and the normal physiological pacing will be activated. The normal physiological pacemaker, the normal pacemaker of the heart is SA node, and the instrument which we are using to deliver the shock, that is called the defibrillator. And the purpose of defibrillation is performed to correct life-threatening fibrillations of the heart, which could result in cardiac arrest. And it should be performed immediately after identifying the patient's emergency, and we should check the patient pulse and responsiveness. And the history of defibrillator. The defibrillator was first established in the year 1899 by the person named Jean-Louis Prevost and Frederick Batelet. These are the two physiologists from the University of Geneva in Switzerland. They actually discovered the electrical shock. It includes the ventricular defibrillation first applied or given to dogs, and the larger charges would reverse the disorder. The first human life saved by defibrillation was reported in the year 1947 by Beth. Principle of defibrillation: energy storage capacitor will be charged all the times, that is AC line, and the energy stored in capacitor is then delivered at a relatively rapid rate to chest of the patient, and the simple arrangement involves discharge of capacitor energy through the patient's own resistance. And this is the schematic diagram of the defibrillator, how it works. The mains, the volts, 230 volts, and the energy will be transformed automatically, and the T1 energy will be transformed automatically to T2, and it will be energy will be supplied to the defibrillator. So once we are pressing the charge button, so after getting charged, it will give an alarm, and then we will be applying the charge. That is, we will be applying a shock to the patient's body via the electrodes or the the paddles. And the discharge of resistance which the patient represents. So we will be start from the resistance from 550 to 100 approximately for a typical electrode size 80 centimeters square. And the waveform is called as fig and is called a long waveform. The pulse width of this waveform generally 10 m. And here you can see the defibrillator from the duration curve. So we will be calculating the current energy and the pulse duration. So how much joules we are selecting and how much charge we are giving. And from the duration curve, minimum defibrillation energy occurs for the pulse duration of 3 to 10 minutes for most pulse checks. And the pulse amplitude is tens of amperes, that is for few thousand volts. And strength of duration curve, so usually the operator will be selecting the joules from the minimum 50 to maximum 360 depending upon the type of arrhythmias. And we also see some of the factors, that is intrinsic characteristics of patient and depend upon patient's disease and how long the patient is having the arrhythmia, and we should also consider the patient age and type of arrhythmia. And the mechanism, so fibrillation causes the heart to stop pumping blood, leading to brain damage. So defibrillators deliver a brief electric shock to the heart, which enables the heart's natural pacemaker to regain. So the natural pacemaker, as we all aware, that is SA node. And coming to the power of defibrillation, high voltages are required for external defibrillation than for internal defibrillation. So a corrective shock, usually we will give 750 to 800 volts is applied within a tenth of a second. That is the same voltage of 500 to 533 number of AA batteries. And the normal cardiac conduction, we know that normal cardiac conduction will be starting from the SA node, and because the SA node is called the pacemaker of the heart, so as all of us, we have the function of SA node is functioning properly, so that we are maintaining the heart rate of 60 to 100 beats. That is the normal heart rate. So if any occasion, if there is a patient is having a right atrial hypertrophy or athlete patient, and those patients also are having any drug toxicity or any syncope attack or any congenital heart disease, what will happen? The SA node will not function properly. So in case the SA node is not activated properly, it fails to send the impulse as like the heart rate 60 to 100 will not be maintained. So what will happen if SA node fails to send the impulse? The AV node will be taking the charge, but the AV node will not function as like SA node. So AV node can send the impulse only she has the capacity of 40 to 60. So in case AV node is activating or dominating, you can see the patient's heart rate will be maintained only between 40 to 60. And even some occasion, the patient has the right heart failure, both SA node and AV node will not function properly. So who will activate? Bundle of his will be activated, and automatically it will be started dominated by Purkinje fibers. And such occasion, if that bundle of his or Purkinje fibers dominating, the patient should be maintaining only the heart rate less than 40 beats. So in such occasion, the patient may go for complete heart block or right or left bundle branch block. And the cardiac arrest, so that is the occlusion of coronary artery lead to ischemia. So if there is any plaque formation, you can see the diagram, the plaque formation in the coronary artery, which leads to diminished blood supply to myocardium. So as a result, there will be an ischemia will be occurring. So ischemia leads to infarct, which causes interruption of normal cardiac conduction. So ischemia, if it's prolonged for a long time, what will happen? The ischemia prolonged for a long time, which results in the complete cut of blood supply to myocardium. So the infarction equal to ventricular fibrillation by ventricular tachycardia. So what are the shockable rhythms? So both ventricular fibrillation and ventricular tachycardia, both are shockable rhythm. You can see the normal sinus rhythm in the first diagram, and when the patient is having the ventricular fibrillation, you can see what's the rhythm. And the ventricular fibrillation, what will happen? The contraction of atria will not be occurring, only the ventricular will be contraction, and there will not be any coordination between the atrial and ventricular contraction. only the ventricle will be contracting faster. And even in ventricular tachycardia also, you can see the contraction will be starting from the AV node, and it will be passed, the impulse will be passed to the right and left bundle branches. And the defibrillator electrodes, types of defibrillator electrodes are spoon-shaped electrodes that is applied directly to the heart, and padded type electrodes applied against the chest wall, and pad type electrodes you can see in emergency situation. Usually we will be carrying the automatic external defibrillator, that is pad, applied directly on chest wall. And the defibrillator electrodes, you can see that the electrodes, it will be having an insulated handle, lead, wire, and there will be control switch, and that the electrodes will be having an insulating dowels, there will be a control switch, and this is the size of the defibrillator and its parts. Defibrillator electrodes, the pad type, you can see this is the thing which is mainly it will be kept inside the first aid kit, and which one they will be carrying whenever they are going somewhere. And electrode placement of automatic external defibrillator, that is anterior, we will be keeping the electrodes anterior, we will keep in the apex of the heart. Classes of discharge waveform, there is two types, monophasic pulsar waveform, biphasic. So there are two great general classes of waveforms. Monophasic waveform, actually the energy will be delivered in only one direction through the patient's heart. But what is the advantage of biphasic waveform is energy will be delivered in both directions through the patient's heart. So classes of discharge waveform, this one you can see the energy is delivered both the sides. So here the biphasic waveform is preferred over monophasic waveform to defibrillate. So monophasic type give a high energy shock, that is 360 to 400 joules. But what will happen? There will be an increased cardiac injury, and there may be a chance of burns occurring in the chest. But the biphasic type always will be selecting the lower joules, that is 120 to 200 joules. So with each shock moving in an opposite polarity between the parts. So types of defibrillator, you can see that internal defibrillator, the battery will be kept, we will keep the battery inside of the heart, and the external defibrillator will be giving the shock externally. So types of defibrillators, internal defibrillator, electrodes placed directly to the heart, example pacemaker, and external defibrillator, electrodes placed directly on the heart, that is automatic external defibrillator. And coming to the external defibrillator, for each minute elapsing between onset of ventricular defibrillation and survival. So every second, if you are losing, the survival rate will be decreased, and the defibrillator should be portable, and it should be battery operated. And as a nurse, whenever we are taking charge, every time before starting our routine work, we have to check the defibrillator whether it's charged fully, and working condition of the defibrillator, and all the modes, everything is working, and the function of the defibrillator, everything should be checked it, and always we make sure the defibrillator is active, because so that we can use the defibrillator in an emergency situation. And the energy in defibrillators usually stored in large capacitors. So total energy stored in capacitor, that is denoted by WC equal to 1 by 2 CV square. VC we call it as capacitor voltage. So coming to the external defibrillator, it will be starting from power supply. So the power supply will be delivered once we are charging the charge button. After charging, we will keep it standby, and we will switch it under operational control, and the energy storage we will be selecting how much joules depending upon the type of arrhythmias. We starting from 50 to 350, 400 we will be selecting. After that we will be discharging the shock, and it will be passing through the gate, that is timing circuitry, and it will be applied to the patient, and the effect of your shock, whether it's reverted, the arrhythmias reverted to sinus rhythm or what, we can record it in the ECG monitor. So apply shock about 30 minutes after QRS complex. and avoid steaming. So what is automatic external defibrillator? Shortly we call it as AED. So here you will be having the green and red button. So the green button we will use it for on and off button, and here the directions will be appear on the screen what you have to do next. So everything it will be indicating a message to you what you have to do, and once it says that machine ready to shock, you have to shock by pressing the shock button, and electrodes should be placed on the patient chest, apex and sternum. And automatic external defibrillator is a portable electronic device that automatically diagnoses the ventricular fibrillation. And automatic refers to the ability to autonomously analyze the patient's condition. And automatic external defibrillator is a type of external defibrillation process. And automatic external defibrillator requires self-adhesive electrodes instead of hand-held paddles. So always you will be giving the self-adhesive electrodes for automatic external defibrillator. And this automatic external defibrillator uses voice prompts. It will give the voice, it has light, and you can test messages to tell the rescuer. So always it will give the spontaneous messages, it will give that automatic external defibrillator what the rescuer has to do next. So it will be giving a message. Working on automatic external defibrillator, so we will be turning on or open the automatic external defibrillator, and it will be giving the instruction. So first it says to connect the electrodes to the patient, avoid touching the patient to avoid false reading, and automatic external defibrillator examine the electrical output from the heart and determine the patient in a shock-coupled rhythm or not. And when device determine the shock is warranted, it will be charge its internal capacitor in preparation to deliver the shock. When it charge, it will device instruct the user to ensure no one is touching the victim, and then to press the red button to deliver the shock. Many automatic external defibrillator units have an event memory, so which store the ECG of the patient along with the details of the time the unit was activated and the number and the strength of the shock delivered. And the precautions, so the paddles used in the procedure should not be placed on the woman's breast, or if in case the patient has any internal pacemaker patients, we can't use the pads over that. And before the paddle is used, a gel must be applied, because what will happen is if you are not applying the gel, it will be causing burn to the skin. And what are the risks in defibrillation? So repeatedly, if you are giving the shock, there may be a chance of skin burns, and the defibrillator patterns are the most common complication of defibrillation. Other risk, there may be a chance that repeated, if you are giving high doses of defibrillation shock, there may be a chance of injury to the heart muscle or normal heart rhythm, and even there may be an occurrence of blood clot. So what is troubleshooting? So attach the internal and external paddles. The monitor reads no paddles, and check to ensure. So if it shows that there is a troubleshooting, it shows that you are not giving the charge and the charge is not delivered to the patient's body. So you have to ensure the paddle is placed in the patient's body correctly, whether the leads are attached and the AC power is on, whether that defibrillator has adequate charge, or whether the battery is working, and you have to select the energy, select control settings. Everything you have to check before delivering the shock. And change the electrodes, and if it shows that the electrodes not placed, what you have to do, you should change the electrodes and make sure that the adapter cable is properly connected. Sometimes what will happen, the adapter cable and the electrodes will not be connected properly, there may be a loose connection, that also indicates the pacer failure. So in such a situation, you have to restart the pacer. And close the recorder door and the paper roll if the monitor reads check the recorder. So these are the references: Willis Tachycardia, external defibrillator, and in Wikipedia www.slideboard.org. Thank you.